Hello, everyone, and welcome to the Global Roots podcast. I'm your host, Fatma Albaki, Director of Operations at Global Roots of Louisville. Today, we're joined by Shreeta, the Executive Director of Kentucky Harm Reduction, to discuss substance use prevention, harm reduction, and overdose awareness, and the important work being done to support the individuals and families across Kentucky. Here today, I have with us Ms. Shreeta.
How you doing?
Good. How are you?
Good. So first, I want to thank you and congratulations on your role. This is my first time meeting you. So I'm Shreeta Walden. I'm the Executive Director with Kentucky Harm Reduction Coalition. I'm a licensed clinical alcohol and drug counselor here in Kentucky.
Thank you for coming back.
No problem.
Good to have you. So my first question I have for you is, can you tell us about Kentucky Harm Reduction, the work your organization does, and what inspired you to even become involved in this field?
Okay, sure. So I know that if some people have watched this before, they're going to hear, they've heard that answer. So I think it's pretty cool to come back around this time, almost maybe a year. But this time sharing that what inspires me about being at Kentucky Harm Reduction Coalition, where our name of what we do is in our title of our organization. We provide harm reduction access and resources throughout the state of Kentucky, not just in Jefferson County here in Louisville, through our three pillars: engage, educate, and empower. We have been really working to, expand the mission of how we educate our community by launching this year our project, which is our learning management system, our training institute for peers. With Engage, Educate, and Empower, what we've done since I started in 2022 was engage communities by meeting everyone where they are. That includes not just our participants, people who come to access resources like overdose prevention and making sure they have information on substance use and substance use disorder. But we also work with our political leaders. We work with our leaders in other organizations by meeting the needs of their team, finding out what are the gaps. Where do you feel like your team needs support? Me having almost 20 years of work in social services, from being born and raised in Chicago, Illinois, and coming here to Louisville. So having an idea of what the landscape looks like from a big booming city down to some rural areas, finding out from communities, what is it that we can do to help them reach the communities they serve? What kind of skills, what kind of therapeutic interventions, what kind of substance use disorder prevention efforts can we do to help tailor to communities? And that's that education pillar. The third pillar of our organization, Empower, is natural. I say it's the organic, it's the 1 + 1 = 2. If you engage and meet people where they are, then you provide them with the resources, the education, and the things that they need within their community, then they're empowered to make better choices for themselves. Mm-hmm. So I'm excited to come back and share that that's something we are starting this year.
Awesome. So my next question for you is, for those who may not be familiar with the concept, what exactly is harm reduction?
So, and I'm glad you asked that, because we now are, as opposed to a year ago, we're sitting with new legislation and which is policies that are talking about the words harm reduction, and have kind of made harm reduction sound like a scary term. Mm-hmm. So to talk about it now, what is harm reduction? Well, harm reduction is not just about us providing training on how not to overdose. It goes deeper than that. It's about connecting communities and people to healthcare supportive services that they need. Mm-hmm. If people have access to clinical spaces like therapists, clinicians, people they can talk to who do not judge them, reducing the stigma behind it, the shame of walking into medical providers' offices. If we can do that is harm reduction. Making sure that we educate our providers, making sure we talk about what implicit bias really looks like, what it looks like when we're working with communities that have different belief systems, having a female or a woman practitioner talk to a male about sexual health may not be appropriate for some communities, and helping our providers understand that that's why you won't see those males come into your office, because they're not going to talk to you comfortably about something that's very intimate, vulnerable, and private. So harm reduction is bigger than substances. And I think that's the message that I'm always preaching to people is we got to go beyond just substance. What we mean by meeting people where they're at and working with people who use drugs is saying that a person who uses drugs should not be eliminated from access to resources and adequate health care. That's what we're saying. We're also saying that 99.9% are people who use drugs, because if you've taken an ibuprofen and a Tylenol because of a headache, or you've taken Pepto-Bismol because of a stomach ache, or you've taken Midol because you got cramps, what are you? Are we talking about illicit drugs? Are we talking about things that aren't legal? But what about the person who continues to have an A1C that is really high, which is leading them to having diabetes because they continue to consume sugar, which in itself is addictive? So we're not talking about that one. Or what about caffeine? I love coffee, right? What about nicotine, tobacco? We're not talking about the things that are acceptable. So what we do is say harm reduction is we don't discriminate. If my person, my love of my life come in the house, and every time I look up, they're taking a Tylenol, they're impacting their liver, then I need to ask them, well, are you eating enough? Are you getting enough rest? How much water are you drinking? Are you drinking enough water? Like, are you consuming water so that you can not be dehydrated? Most of us here in America are dehydrated, so harm reduction is, did you wear your seatbelt coming to work? Harm reduction is to prevent cavities and gingivitis. Are we teaching good oral health by brushing your teeth after meals, not just in the morning?
Honestly, your explanation was so eye-opening. Like, I never thought about it in that way, where it's like it's not necessarily just, drugs. It can be everything.
It's everything. It's everything. We've taken it and applied it. And I think that's honestly something in the field of harm reduction we've done the disservice too, because we focus so heavily on protecting the community of people who have been marginalized. We focus so heavily on protecting people who have been harmed by systems that we put ourselves in this bucket. So when people hear harm reduction, now, we don't need Shreeta to come because, so I'm like, no. Are we talking to our youth about why substances hurt, how it can hurt their body? Don't just talk to them about not doing it, but saying, hey, like we do with brushing teeth. We don't say it's a punishment to brush teeth. We say, hey, we want you to make sure that you don't have to go to the dentist and you have a toothache. So if you brush and you floss, you get between your teeth, you're going to prevent the germs and bacteria to sit in your It's the same thing. Hey, my daughter wants to enjoy cannabis. Let me talk to you about how it can impact your cognition, how it can impact you remembering or recalling quick enough, right? Helping people understand what they're putting in their body is a big deal. We do it for anything else. Look at the warning labels on Tylenol. Next time you take one, it lets you know too much, it impacts your liver. Ibuprofen, when you go to the doctor and you do get pain medication and they say, now be careful with ibuprofen, you need to coat your stomach so I'm like, why we don't do that with substances?
So I have a connecting question, I guess.
Okay.
How much does prevention play a part in reduction?
Great question. I like that a lot. It's actually all of it. So when you think about reduction, right? If I'm reducing something, I always, when I talk to other executive leadership, because your role is in executive leadership, is we talk about risk reduction in work. It's prevention. For instance, I'm gonna put my team on blast real quick, right? We get a lot of deliveries for all of the resources, things we collect. And our office space, the main area, is really tight. And we're trying to add something else into the office. So I stopped my team and I was like, hey, before we do that, I need to make sure that we have a plan for all the boxes that we get, because not that it happens every day or every week, but when we get a large shipment, then we have an immense amount of boxes. And I said, what happens is people with depth perception issues like me, I don't know how many times I almost ran into a box, and I actually ran into this pole because I can't quite see how close I am to things. And I said, all I can see is a box toppling over. And my role as the ED is to make sure that we don't have a bunch of workman's comp claims. That's prevention. The preventative piece is in me reducing the harm in my workspace, is saying what we need to do to prevent the harm, which hence is harm reduction. And people, I mean, our state, our city, lawmakers, grant creators, right, proposals is so interesting to me when they say, okay, we want this to be a pillar for people to apply for prevention efforts, and then we want an intervention. I was like, oh my gosh, how did y'all pull that apart? Like, how do you pull apart intervention from prevention? It doesn't make sense to me, because in the effort of preventing, you're intervening. You are actually doing the intervention. I think that's what hurts our communities. They'll say, Global Roots, you're going to do an intervention component to the prevention stuff that KYHRC is going to do. And I'm like, you've separated us. We actually are working on the same thing. Why don't we all come together? Because this is all prevention, just like the highway. If I'm going to go out to, the mall, St. Matthews, and I'm going to take 264, and you say, let's go out there together, but we're driving separate cars, we both have our GPS on. This is why I tell people, okay, I don't need to follow you, because I may not like your driving style. You may not like mine. But we go the same highway, but we may get there differently. But we're on the same highway. That's how I see it. We all doing prevention. How you do it and how we come together is where we need to. Don't separate the pathways in these grants, because it causes us to separate our worlds. That's how we hurt people, because people fall through gaps. But if we're all on the highway and we say, look, we all going the same way, but you're going to weave this way, I'm going to weave that way, we going because we're going to get there. You may decide, you know what, I want to get off here because I like this one street, but you're going to say, we're going to get there. We're going to get to the same mall. Nobody said we had to go the same way. That's how I feel about it. And I wish that message, I want people to embrace that analogy and think about it. How often have people gotten into car accidents following too close because they said they want to tell somebody? Because we don't pay attention all the time. I may be a person following you and I'm working on my harm reduction, but I may look down at my phone. You may need to stop quickly. Then what happens? I hit you. Because we're just going to follow me. I know the best way. But is it the way for me? Can you just give me the address and I get there and you get there and we know to get there at the same time? We may end up on the same road at some point, but it's okay that we find different ways to get there. Now we can share.
To the same destination.
Isn't.
Same thing.
I think it's a beautiful way. And I got people to listen to that. Just give me the address. People have refused it. I think it's crazy. I'm like, give me the address and put in my own GPS. I know the way. So what? I may not be comfortable. I may be a person who don't like highways. And I don't want you to know that yet. So why not allow people self-determination? That's harm reduction. It's how do you get there? I'm giving people options, education. I do it to my own children who try things that I don't want to try. Dealing with people I wouldn't want to deal with. I give them the options and I say, let me use my faith that they'll make better choices because they have education, they have knowledge, and they know they have options.
I love it. Let's see. What are some of the biggest challenges Kentucky communities are currently facing when it comes to substance abuse, addiction, and overdose prevention?
I think is part of what you asked with the intervention and prevention piece, or reducing and prevention. I think it's a few things. So one challenge is that I don't think we connect very well with the systems who provide the consequences or the fallout after something has happened to the community partners who are trying to do the work to prevent the consequences. So our youth, trying to help our youth live, first of all, stay alive. I think there's so many barriers. And as I've watched over the last few months, as we've been spiraling towards the summer and watching the teen takeovers across the United States, so not just here in Louisville, the more and more I look at what's happening and I'm saying, we're doing the same thing that generations before us did, is we disconnected and said we don't know what to do when we do. We are not engaging our people directly. We're operating out of fear. Mm-hmm. We can't do anything about how the system is going to operate. The system is going to always do what it's meant to do, and that is to protect the assets of the people who make the decisions. I didn't say it. We see it. Just look at it. They're protecting the city officials, the state officials. It has nothing to do with us. We're the ones who are doing the work. So because we know that, when I really sit back and assess what's happening, it's what are we afraid of? Why are we afraid of our youth? Have we allowed media and messaging to make us afraid to connect with the very young people who are really begging us to connect with them? I had an idea. In my hometown, I saw a posting on social media about the last teen takeover. It spiraled out of control because if you leave a bunch of youth to their own devices, stuff gonna happen. I said, one of my friends, who's actually like a brother-in-law, my stepdad's son-in-law, is leading an organization, and he said, we should put some voter registration. Go out there and do some voter registration while the teens are taking over. And I said, what if community partners here in Louisville went out there? The next time all these teens come together, the police are going to show up. Mm-hmm. Why are we letting the police just show up? Why are we letting law enforcement handle it? Why are we going to let law enforcement take care of it? First of all, teens have a right to come together if they want to. Why are we telling them they can't come together? That sounds a bit oppressive. And I don't know. I come from a marginalized community. I don't want nobody oppressing me. Why are we oppressing them? Why are we saying they shouldn't be coming together? Now we telling the teens you can't go down to the waterfront. You can't go on the bridge. You can't go into Smoketown. You can't go. Oh, I said, sound like a lot of oppression around here. How's that working out for you? Because I know during the big civil rights movement, when it kicked up, Black people were told not to go nowhere. But you do. You win. So they're going to do it. So why not we go down there and meet? Now, I'm not foolish. I'm not going to go down there by myself and say, come on, kids. I'm not. What I'm saying is, what would happen if law enforcement showed up, we showed up? We say we do prevention. We say that we're part of intervention. Why are we there? Why do we wait until the cool festivals and until the pride parades and all of the events, including me? We do it. Why do we do that? That's the hard question. The barrier is, will community partners and leaders finally take a look in the mirror and say, how are you being any better than the system? And if we do it, imagine the beauty that comes from that. Every time I think about it, I'm like, I get chills because I'm like, the police showing up? So everyone that's terrified because they think all the kids just walking around with pistols and assault rifles, okay, fine, I get you, because I feel you. These kids can be a little ruthless sometimes, so I don't know. Every time I think about that, I'm like, so I hope that we can imagine it. People commented, organizations did comment on my post, but I'm like, who's connected to the kids? What teen is going to tell us? So we're showing we're just disconnected. So the biggest challenge with even talking to youth about substances is we're too disconnected. Collectively, there are parts, like all of us have a group of people that listen to us. What if we came to the table and talked about why? I have a group of youth that come to me all the time. I have techniques. I tell people in my home, because I have young adults. My daughter will be 25 next month, my oldest. And I have a candy dish of, actually I need to fill it because I'm always talking about it and I'm like, I don't have it sitting out full anymore. But it had Narcan, it had drug testing strips, it had condoms, lube. It's a candy dish of those things. It's a conversation starter. I start at home because it trickles out. Now I'm a safe person. So now they know where they can come. Some of her friends have talked to me without talking to her about their substance use. So how am I doing it? How can we scale that and make sure that we're all connecting to you? Because youth are where we need attention. They're about to reopen that juvenile detention center. And who do you think they gonna lock up? They not going to the East End. Mm-hmm. So I'm like, which one we gonna do, y'all? Are we just gonna wait till they get in there? Or are we gonna get out there and say, listen, it's coming? Because they got an answer. The city has an answer. It said we got the detention center coming. That's my barrier. And my barrier is how to get organizations to sit down and say, we are the ones to do it. Why are the police always showing up? Why we don't show up with them? I know, something to ponder and think about.
What can families and community organizations do to educate young people about substance abuse, reduce stigma, and connect people to support before a crisis occurs? You kind of touched on it.
I think, and if I was even, since you're the organization that invited me into your space, what I would share with you all is start with the basics. The youth know. Ask them. I think we ask each other all the time and we never get nowhere because we're not talking to them. We're not asking them, tell me, what is it? You know how I connected with my daughter around her substance use? I asked her a strange question to her that wouldn't have been strange to older folks, adults, which was, I said, what's her relationship to alcohol? She was like, relationship? What you mean relationship? Because in her head, she's thinking of a person. Mm-hmm. But when I asked her and her friends, something started happening. First, I had to sit quietly with that and let them giggle it out and let them, so y'all ain't no little kids, they're in the 20s, but they're still immature. And then once they got their little giggles out, they're like, I don't know. I mean, I like to feel good and I like to have fun. And when I'm hanging, I feel like I talk more. I had to find out what it is that they enjoy about it. I can't come in and be like, you really shouldn't do that. Why? How do I know they shouldn't do it? Mm-hmm. They may feel like that's the only thing they can do because they don't have no skills on how to engage with people they like. Mm-hmm. They don't know how to talk to people. So I'm learning the things they're lacking. Have we asked the youth? I remember talking to youth, and I remember one kid, I can't remember what program I was doing, but a kid said he liked when his parents were getting high, like they smoked weed together. You know why? Because they loved each other. They enjoyed each other. So can you imagine what that youth is taking in now? Like, okay, so to enjoy and love a person, just smoke and get weed, we get high together. That makes us like each other more, right? I was like, if you listen to youth, they'll tell you everything you need to know.
You just gotta ask.
We gotta ask. We can't be afraid to mess up. We can't be afraid to be lame. I'm 47 and I really do feel like I'm still 20-something. Like, I hate when my kids tell me I'm lame. I feel like I'm the closest thing to being cool. Mm-hmm. I still see myself as the Black girl that went to Clark Atlanta University in Atlanta, Georgia. I still see myself young, but I'm not. I'm almost 50. And I have to be okay with the fact that there are things they still don't want to talk to me about. So now I have to bring in a young person who's younger than me, but as old as them, and teach them the skills so they can connect. I got to find someone who can meet them where they at because they're them. And that's my task. And it's hard because I'm looking and they're hard to engage. I'm not going to lie. It's hard trying to figure out to get them to trust me. When I start off with people, another thing I tell people is leaders, and then I'm going to say one thing about families, but leaders, tell the youth, you don't have to trust me. I'm asking you to try me. That's a line that I use with not just youth, but adults. I'm not asking you to trust me. I'm asking you to try me.
I really like that.
Yeah, because why would you trust me? You don't know me. You don't know if I'm going to hurt you. You don't know if I'm going to take your words and use them against you. Be honest. Show the obvious. Just see me, check me out. Give me a little thing. Families. Culturally, you are sitting in a space of influence. You know what's accepted in your culture and what's not. You know what conversations can happen in the house and what's not. I don't. I know about my culture as far as being Black from the south side of Chicago. I'm not Black from the west end of Louisville. So I have to ask people. But when you look culturally, when I think about women who are in my peer group, understanding, I remember the first time for HIV, I knew that I couldn't do a lot of talking. I have to do a lot of showing. In my community, in my groups, culturally, meaning my social groups, I have to show people. I can't tell you. So at a church I was with, and my daughter, we've been having the conversations about sex in my house. I knew that wasn't a conversation in this Black church they were going to have with their kids because they ain't having sex. Mine was, though. They saw my daughter go in to this public health event we had, and she got her HIV test. She's a teenager. I had 3 moms come to me after she came out because she posted it. She said, I am HIV negative. And so I'm telling all my friends, I had women coming, oh my God, how did you do that? So I have to show you. And when they asked me, I said, my daughter said she was having sex. How did you know? Well, I mean, I did what any parent would do. I was going through her cell phone and I saw her talking about sexual activity. And I asked her, what was this about? And I said, she didn't come right out and tell me. I said, I want to tell you, if you don't tell me, I need you to tell someone. She ain't have to tell me nothing. And they were like, well, I'm going to make, I said, I didn't make her go in there and get HIV tested. I said, hey, you see them, you could talk to them about anything you want to talk to them about. She went in there and did it. If she chose not to, she chose not to. Learning how to have that conversation with the people within your community is going to be key. If I tell you, tell moms to ask their kid how their day was, and you know, they're not going to tell their mom they got in trouble or that they're intimidated or something, then it's not going to be effective. But what will be effective in your community for them to go home? Is home the right place to start? Is creating mothers groups, having moms, talking to moms and educating them about some of the complications that are happening in these groups in schools? Is it talking to moms and dads separately to say, this is what's happening, I want to tell you, and asking them what would make you feel comfortable? Would you be comfortable with your daughter or your son coming in the house? So passively is fun, is learning all the avenues, is learning, is it the highway or the streetway? And who wants to go where? Is it a longer route? Yes. Is it time consuming? Absolutely. But at the end, is the payoff worth it?
100%.
100%. Because regardless of the decision, If I told my daughter, you come back with a sexually transmitted disease, I will be able to sit with you and cry and grieve. But you know what I won't never have to do is regret that I didn't tell you.
It's okay.
And you're self-determined, right?
I'm smiling because it really does go back to those highway, street, and all the final destination.
That's it.
That's such a perfect way to put it.
It gives me chills to think about it.
Yeah. Wow. So my last question for you is, what gives you hope for the future, and what message would you like to leave our listeners about how they can have a positive impact on their communities?
What gives me hope is a couple of things. So today, coming back, a lot of times I'm invited into spaces and talk about some hard truths, and I don't get invited back. And it's not because people don't like me, it's because things come up. Coming back a second time lets me know that it's moving the needle. Doesn't mean that there's some drastic changes. I believe the details show me the intentional love, the radical love that we have for each other. That gives me hope. The second is that I'm still doing the work. I was told when I first got in this career by a couple of my colleagues, they were the vets in this space. And I came in smiling the same way I smile now. 18 years, almost 19 years later. He says, you're not gonna always be smiling, girl. This gonna drain you. You just not gonna always watch one day. I'll say this, there are days where my heart is broken. There are days where the weight is heavy, where my body hurts, where my head hurts, where I fear, where I feel tremendous sadness, where I have to take a break, where it impacts my mental health. I'm also a smoker, so I may smoke more. So it does stuff to me. But what has not left is the joy of getting up and having the opportunity to constantly do the work that I love to do, and to see communities impacted, to see the tabling Saturday at the event, to see overdose prevention in this space. It did something to my heart. It makes me emotional because I get to see the impact. The conversation I had earlier, it's the little things that I get to see. It's not going to always be what I want community and what I want families to know. It's not going to always be the big things. And I think we spend a lot of time and we waste a lot of time looking for the big firework moments. But seeing Abdi, and that was you at the table, right? Saturday. That shows me we are moving a needle. I didn't see that kind of energy just the year before the first one. So I'm like, that's the fireworks for me. The Fireworks is an organization that I worked with in my first year, asking me to do an interview for their website about collaboration and growth. And this organization connected me to a research project on hepatitis and liver disease in my community that we just started this year. That wouldn't have ever happened without collaboration and partnership. So I get emotional because I'm happy, because these moments I look for, because the work is hard and it takes a lot of time. I lose money every year from some entity, and then I end up gaining it back in another way from another entity. And it continues to inspire me to show up every day. No, everything isn't always great. But knowing that I'm going to have a moment where I can see that the seed that I planted 6 months ago, a year ago, 2 years ago, sitting at a table, talking to Farhan for like 3 or 4 hours, having samosas and tea would lead to true partnership and relationship. That gives me hope to continue. If you're sitting in a space where you feel like, I don't know where the answers are, start with the unlikely people. Maybe your issue, it has something to do with, I'll start as little as, you don't get an asthma pump for your kid. Come to this space. Try the people here. Try Fatma. Did I do it right?
Yes.
Thank you. Try them. Even if it's something way out, you like, I don't think nobody can help me with this issue. That is how we begin to help our communities. You gotta try us. You gotta see, I'm doing work that I do today that I would have never done 5 years ago because people tried me. They asked me. And that's all I got.
Oh, I'm still thinking about that highway.
I know.
Like,
isn't it a beautiful visual?
very.
And on the days that is really tough, think about the highway.
Well, thank you so much.
No problem. Thank you for having me back. I really appreciate it. I do want my tea. Let Farhan know. I want my tea. I have not had tea in a while. Now I have come down and gone to the restaurant and got it myself. And I will today since I'm over here. But I want to be invited back for tea. We need to sit down. We need to meet and talk. So you take some time, think about it. It could be a month from now. It could be 6 months or next year. I'm that kind of person. You do not. People like, they'll get, because we start tripping in our head. We'll be like, I haven't called them. It's okay. When you have the time and capacity, let's connect. And I'm serious. We just spent hours out here talking, and it's a part of building community and your culture. I know it is. I learned a lot from Farhan and his team. So I'm like, yeah, you want to sit down and you want to have conversations so we can learn more. I'm here for it.
Let's do it.
Okay.
Yeah. Thank you.
Okay.